So, now I tell about COVID and how can we manage COVID and how the ventilator support we would have. A brief idea or a little bit of basics about this, because yeah, COVID is such a dreadful disease and such pandemic. So I thought about telling something about it or so. So now we are taking case of the patients which are RT-PCR positive patients. So we can categorize the patients into mild patients, moderate patients, and severe patients. Okay, so for the mild patients, after a person has got the COVID infections, so the mostly the incubation period is 1 to 14 days of incubation period, but sometimes we can see the patients which are coming with a positive report after 17 days or so. So but the mean incubation period we can say it is between 4 to 8 days or so. Okay, so like what happens in the mild COVID? So in mild COVID there is not much thing, not much thing actually. There is little bit sometimes fever. Okay, it can present with fever or like a sore throat. Okay, and or myalgia, muscle pain, and it can present with diarrhea, or yeah, a little bit sort of weakness or so. So and mostly of the mild patients or mild COVID, 75% patients that we get are asymptomatic. So this patients doesn't actually know they are having COVID. So yeah, so there is nothing much we can do in this, and the patients resolves by its own. So we just support the patients and see. Actually, looking more deep into it, so what happens? The COVID virus actually loves cilia. So wherever there is cilia, so there it comes, and in the cilia there is ACE2 receptors where the virus attaches. So virus attaches and it goes inside the cell. So in the first stage, this mild COVID phase, there is only mostly the upper respiratory tract sort of infection, and there is not much anything of the lower respiratory tract infection. So and from patients those mild patients generally present up to 3-4 days of this presentation, and we can see by day 5 or so, the patients are gradually recovering and doing good. So now let's talk this. In ACE2 receptors goes inside and it replicates. Okay, so one study has been shown that there has been a CXCL10 in some patients. This has been really reduced form. So this reduced form of CXCL10 has a high propensity, of turning to moderate or severe form, landing up to other complications or so. So we don't know how can we measure the CXCL and how to see this, but we don't know, the proper explanation is not so, but we have confirmed evidence that CXCL is giving rise to it. So moving on to it, for management of this mild patients, we can just quarantine him, give vitamins and zinc also, and for fever we give paracetamol. If fever not resolving, then we can try naproxen also, and we give him adequate hydration also. And yeah, the patient gradually resolves, like the patient feels better as the day, as few days progresses, and he'll recover also in 12 days or so he'll recover. So now the main thing is that patients with moderate COVID, there lies the catch point, and there have been a lot of patients, and it is the main area that we are trying to focus, because it is the area that we have to treat. So what happens in moderate COVID? In moderate COVID, there is endothelial, epithelial interface, of lung where COVID virus reaches. Okay, so due to it, there they attacks type 2 epithelial cells. Okay, so due to this attack of the type 2 epithelial cells, there is decrease of surfactant production. So this decrease in surfactant production is a major thing, because surfactants which are present in the lungs prevents the alveoli from getting collapsed. So due to this absence, or due to this decreased production, the alveoli would get collapsed. What are the chances of the alveoli to get collapsed? Is it inspiration or expiration? It's an expiration that you all study in physiology. So when expires, this alveoli get collapsed because of the decrease of surfactants. And so, and besides that there is also down regulation of CD4. This down regulation of CD4 and everything of this injury and attack, there is what? There is exudate formation. So due to this exudate formation, there impairs gas exchange, and the patient presents with dyspnea and other features. So how to say it is moderate COVID? In mild COVID patients, the saturation will be really good, maintained around 97-98%. It won't fall at all. Whereas in moderate COVID, you have to see the SpO2 levels would be below 94%. Like I would give an example that a patient is 96-97, but sometimes his SpO2 stays at 94% or so, 93% or so, then we would categorize him as moderate COVID, or his respiratory rate is more than 24 breaths per minute. Okay, so to categorize it, we would look at these parameters. So, and what happens, I have told that in mild COVID patients, the patient recovers on the 5th day, where if the patient goes into moderate COVID, mild COVID, look, there is only what? Upper respiratory tract, where in moderate COVID there is involvement of this lower respiratory tract also. So if the patient goes into moderate COVID, so we'd see the patients on the 5th day or 6th day or so, the patient is worsening, the symptoms are worsening, he's having dyspnea and everything. So yeah, so that's what we have to see and look and manage. So like its general presentation is, we can see about 5 to 10 days, we can see that moderate COVID or so, moderate COVID or so. And the best thing that we can do is CT scan to see how it is, to stage it properly.